Manhattan is a city of walk-up buildings.
Hi, Paula.
If you're old and you're frail, or if you have a stroke, or if you have an amputation, you're stuck. I work in a group practice that does house calls. The average age of my patients is in their mid-80s. They all have a lot of medical problems. People tend to disappear from the medical system at the time of their lives that they need it the most. These people tend to disappear for 2 or 3 years in which they coast without medical care, and then reappear into the system after they or somebody else called 911. The service that we provide catches people in that window of time that things can be prevented.
The Visiting Doctors Program is a group of doctors, nurse practitioners, nurses, and social workers who provide primary and palliative care services, so medical care to patients who are homebound.
Here I have a box where I keep all the little things that I need, blood drawing supplies, things to clean in the ears, alcohol binding.
We were started in 1995 and grew into what's now 12 years later the largest academic home-based primary care program in the country.
A few colleagues and I were the ones who started it about 10 or 12 years ago. Some of us believed that we did it because we recognized there was a great need for this type of care. We were desperate for something to do that was going to reinvigorate our practice and make it fun to be a doctor, despite all the pressures of 20th century or 21st century medicine.
We're in the patient's bedroom or living room or kitchen, and we really, as the physicians and as the trainees who are with us, we really have to mold ourselves around the patient as opposed to the patient molding themselves to fit the doctor's office.
After doing this for a number of years, I can't even imagine how I would ever feel like I'm doing a complete job if I just saw a patient in an office in a gown. When you see somebody in the office, you know, you might notice that they look a little disheveled or they smell like urine, or something, but it's something that you can put in the back of your mind and be like, okay, let's worry about the blood pressure. And a lot of the people that we see, you know, their high blood pressure is the least of their problems.
Very often, most of what their patient needs is not a physician presence. It's another human being who cares about them. And sometimes it means that what you learned in medical school, that you spent all that time learning in medical school, takes a backstage to your ability to show a little bit of humanity and compassion to people. We think it's cost effective. We're incredibly low tech. Almost all of what we do comes out of a doctor's bag. And so our focus is really patient-centered and what the patient wants out of their health care in that stage of their life. For the most part, it's not to be in an emergency room, it's not to be in a hospital, it's not to become medicalized. The need is enormous and overwhelming, and we barely scratch the surface. We've never advertised, we don't market, not because we don't want people to know, but because we're terrified of that sort of bottomless well of need.
If you look at the waiting list of people to get into our program, you know, people can wait months to get in, and I'm sure that the people that are in our waiting list are the very tip of the iceberg.
By the doctor coming here is my life safe. I don't have this, like you said, lifeline. That's what it is to me.
There's a huge need for people to do what we do.